Now, lesson 7 is the last lesson in this module, and now things get really exciting. We have confirmed a signal, and now we have to think, what are we going to do in order to minimize the risk for patients? It depends very much on our estimation of the risk. Sometimes wait and see can be an option. On the other hand, the normal first step in risk minimizing is to inform. Inform healthcare professionals, inform patients. Who has the mandate to initiate risk minimizing measures? The responsible marketing authorization holder can initiate risk minimizing measure. And the Drug Regulatory Authority certainly has the mandate to initiate them and also to impose them on a marketing authorization holder who is not willing to do so. There are several steps in the risk minimization process. The first step we take usually is to inform about a risk. We certainly need to inform the healthcare professionals, the prescribers and the dispensers of the drug. But sometimes we are well advised to also inform the broader public. The next step that you see on the pyramid is the amendment of the summary of product characteristics. This is, as we have seen, the label. Now, as we have seen, the label is a regulatory document. A marketing authorization holder can suggest changes to the label, but these changes will need to be approved by the regulatory authority. We might be able to add additional side effects on the label. We might add precautions. We might add contraindications. There is a further step, and we might want to impose a certain restriction on a drug. It might be a restriction in prescription. For example, if we have identified a special population at risk, we might restrict the use of the drug to a population who is not particularly at risk. If we are seeing, for example, that young children are more prone to develop a certain adverse drug reaction, we might consider restricting the prescription of this drug to the adult population. Also, the dispensation can be restricted. For example, cytostatic drugs for intravenous application are usually dispensed only by hospital pharmacies. Another example is isotretinoin, an oral drug used to treat acne. As it has a very high teratogenic potential, in many countries, a pharmacist is allowed to dispense this drug only under prescription and if proof of a recent negative pregnancy test is being provided. The goal of any risk minimizing measure is to keep a positive balance between the benefit the drug provides and the risks it carries. And this is a very delicate balance, because for every patient that might experience an adverse drug reaction on a certain drug, there might be many others who benefit from the drug. And for some of these patients, it might be the only drug that helps them. This is the reason why withdrawal from the market is the very last option that we have in risk minimization. If there is no other way to contain risk, if risk is high, then we will need to withdraw the drug from the market. But we have always to consider that for every drug that disappears, some patients will lose what helps them most. We have heard a lot about disproportionality, about data mining, about combination that stand out statistically. We will, in the next module, look explicitly at all these statistical methods.